So, part two of chapter 42. Moving on to viral diseases, we have about 20 more slides to get through. So, viral diseases are a virus is a small infectious agent that must invade a living cell to reproduce. It has no cell of its own. It literally is just this thing that carries its own genetic info, goes into a cell, uses that cell's machinery to reproduce its genetic info, and then break out a bunch of more little viruses. So diseases caused by viruses: the common cold, influenza, chickenpox, cold sores, rabies, mono, pneumonia, and AIDS. Pneumonia, keep in mind, can also be bacterial. So let's see. After contact, again, viruses are unique organisms because they cannot reproduce without a host cell. They do not contain the enzymes necessary to carry out the chemical reactions for life. Instead, viruses carry only one or two enzymes that decode their genetic instructions. After contact with the host cell, the virus gets its genetic material into the cell and commandeers the cell's activity. Instead of its usual proteins, the host cell produces viral proteins and genetic material, or more viruses. Many viral diseases occur during childhood, chickenpox, mumps, etc. Usually these diseases only occur once because antibodies are produced that protect individuals from reinfection. This is referred to as acquired immunity. Our other option is vaccination, which we do commonly, which is sort of a very, what's the word I'm looking for? A lot of people argue over it. It's controversial. So vaccinations allow us to be immune to something we've never come into contact with. We've only maybe been exposed in a tiny little bit of amount in a vaccination, whether it was live or killed. Some people feel that vaccinations have led to autism. This has been disproven multiple times. Please don't buy into that. Do your research, find your articles. The original article that was published was actually withdrawn by the journal who published it, stating that it was very, very false. So, vaccinations, safe for everyone. Yes, they do have preservatives, but so does the crap we put in our mouths every single day. There's lots of stuff that has junk in it that we put in our bodies. It's a fact of life. You can try to avoid it as much as possible, but no matter what, we still come into contact with certain preservatives, certain chemicals. So, our vaccinations have allowed us to live longer, to live free of disease such as polio, as well as to hopefully protect our elderly and our very young patients from flu if we all get vaccinated. So they don't always get it right, especially with the flu vaccine. That's one of the ones that changes so quickly. Viruses are very good at mutation. They don't always get it right, but hopefully they hit the nail on the head, or they come pretty darn close and at least cut down on the severity of the illness as far as influenza goes. So moving on to influenza. There are several different types of flu viruses. It's a family of viruses, types A, B, and C. A and B infect humans, and usually every year the flu virus will have an A and a B that they think is going to be the most common affecting people. It's spread through sneezes and coughs of infected persons, and it primarily affects the upper and lower respiratory tracts. So, usually most common in the northern hemisphere between November and April, and May to October in the southern hemisphere. A localized wave of infection is considered an epidemic, so that would be 20% of the general population being affected. So there are outbreaks every year. We talked about that. Pandemic is a worldwide outbreak. For example, in 1918, there was a pandemic flu, and 675,000 Americans died. Viral diseases. Continued, H1N1 is a type of influenza. You guys might have heard the scare over that a few years ago, called swine or pig flu. It's a subtype of the influenza A virus, and it is one of the new mutated sort of viruses. It's a little stronger, affects healthy young people. The people over 65 are actually the least likely affected to be affected by H1N1. Let's see. So, symptoms of flu include headache, fever, intense fatigue, dry cough, muscle ache, and sensitivity to light. Symptoms occur 24 to 72 hours after infection and usually last 7 to 14 days. Persons infected develop acquired immunity to that strain only. When that strain mutates, they're no longer immune. Secondary bacterial infections can occur, such as otitis media, which is an ear infection, or bronchitis, because the patient is weak and less likely to fight off that bacterial infection. The thing we worry about with flu is dehydration and convulsions. Patients, because they are so sick, can quickly become dehydrated. So we want to prevent the flu as much as possible, especially in our elderly patients. So flu vaccines are formulated each year, can only predict which strains will be present next year. Recommended by the Center for Disease Controls for high-risk persons or those who could transport the virus to those high-risk persons, such as healthcare providers, i.e. all of us who are in this class. Usually given during October and November, however, they can be given all year long if the person missed it. Moving on to herpes. There are 8 different human herpes viruses, including herpes simplex, herpes zoster, cytomegalovirus, Epstein-Barr virus, and herpes virus 6, 7, and 8. Herpes simplex is what causes, type 1 is what causes our fever blister and our cold sore. Type 2 causes genital herpes. Herpes zoster is chickenpox, basically, and when you get older and it comes back again once it's been dormant, it shows up as shingles, usually in patients over 60. So, let's move on to HIV or AIDS, acquired immunodeficiency syndrome. AIDS is caused by the human immunodeficiency virus, HIV. More than 40,000 new infections occur in the United States every year, and it's the leading cause of death among young adults. Most people die within 10 years of their first symptoms. However, it can go unnoticed for quite a while the virus is kind of building up its army, per se. So what happens at the end of that 10 years or towards that 10 years is their body starts to get taken over by this virus. They no longer have an immune system, and they start to develop opportunistic infections or cancers, which is what kills them. AIDS isn't what kills them, it's the opportunistic infections or cancer that does. Half of new infections occur in people under 25. Women are more likely to become infected now than they were previously. More than 95% of HIV infections today are from sexual contact and or needle-borne infections, so drug users. HIV can exist in the body without presenting any symptoms. It may be present again 3 to 10 years. We already went over that. I think I went back a slide. Keeps sending me back. So, HIV is a fragile virus that can easily be killed outside of the human body, and there's no vaccine or acquired immunity from HIV. The medication regimen is complex, and HIV develops resistance pretty quickly, especially if they're not compliant with their medication regimen. They give that virus a chance to come back, and all of a sudden it's back, it's stronger, and their medication no longer works. So, antiviral drugs, starting again with influenza. Amantadine and rimantadine, used prophylactically to treat the influenza A virus, should be given to patients in high-risk categories. Oseltamivir and zanamivir is both are given for treatment of uncomplicated influenza, and they are only given if symptomatic for less than 3 days. If it's been more than 3 days since the patient's had the infection, it's not given. Respiratory syncytial virus causes severe bronchitis and pneumonia in infants and children. There is a vaccine. Drug used to treat it if the child does have the illness is ribavirin, and it's used in the treatment of RSV infections in hospitalized patients or children, not usually used in adults. Antiviral drugs are listed out on slide 32 that we just talked about. So moving on to herpes treatment. Idoxuridine, fludarabine, and trifluridine are used in the treatment of herpes simplex infections of the eye, meaning eye drops. Acyclovir, valacyclovir, and famciclovir are used in the treatment of cutaneous and genital herpes infections. Acyclovir can also be given to the mother with the herpes infection at 36 weeks gestation to prevent the baby from having that problem. Cidofovir, Foscarnet, and ganciclovir are used in the treatment of cytomegalovirus retinitis in patients with AIDS and acyclovir-resistant HSV or herpes simplex virus infections in immunocompromised patients. So these are the more serious drugs that are reserved for patients who are refractory or resistant to treatment, or patients who, again, are immunocompromised and have that opportunistic infection. Moving on to HIV, and we're not going to get too deep into this because If you're interested, you can certainly research it. However, drug regimens are very complicated and there's a ton of different drugs out there. So there's we're up to 5 different treatment classes now. I don't think this lists all of them. However, it does list fusion inhibitors, nucleoside transcriptase inhibitors, non-nucleoside transcriptase inhibitors, and protease inhibitors. Drug regimens are patient-specific, and the current treatment strategy is highly active antiretroviral therapy, which means multiple drugs, usually multiple times per day, and adherence would be the biggest problem we have from patients. So antiviral drugs, just an overview. Viruses are dependent upon the host. They must use the host cell to replicate. They inject their own DNA or RNA into cells that become mini factories to produce more viruses. Those cells are then programmed to rupture and release those new viruses. Drug therapy is aimed at killing the virus without killing the host cell, and this is difficult to accomplish. Antiviral drugs block virus attachment or disrupt transcription or synthesis. Adverse effects include a long list seen on slide 40 that you can cover on your own. And just some little notes on slide 41 for your information. So that covers chapter 42. Good luck this week. Good luck in your future endeavors. It's been a pleasure teaching you guys and reading your forums and responses. And if you have any questions, again, as always, contact me. Thanks, guys.